Hi, I'm Dr. Mary Stouter, Manchester West Veterinary Hospital. I wanted to bring up the topic of vomiting and diarrhea. It's one of the things that we get frequent phone calls about, and I want to kind of cover it because there's a lot of things out and about, about feeding bland diet, using over-the-counter medications, things like that. Just to summarize, dogs and cats generally have a very responsive gastrointestinal tract. They go out and they eat things, especially see dogs eating stuff in the yard. It's like later they realize that it wasn't healthy for them and they evacuate. So vomiting and diarrhea does occur very frequently. Whereas a dog will be very stoic about other things. You'll see a dog limping around on a broken leg chasing a ball. They're very stoic, but vomiting and diarrhea does get them down. The first rule of thumb, if your pet has vomiting or diarrhea, best thing is to withhold food and water. By not putting anything into the system, you can let it rest and calm down. Then it's worth a phone call to the vet. We can filter through maybe what's been happening. Has he been into the trash? Is it a young dog that's been chewing up toys? Is it an older dog that was feeling fine yesterday? There's a lot of things that we can filter through and get an idea of what's going on. Unfortunately, vomiting and diarrhea can also be a sign of serious disease. We never really want to treat it over the phone. We like to see your pet to see if we can determine whether it requires further testing. A young puppy, for example, that doesn't may not even realize it's chewed up a toy, has some foreign body rolling around in its stomach, and it's just a little vomiting today, but tomorrow it may obstruct, and that becomes a life-threatening situation. An older dog can develop pancreatitis, very severe vomiting, and requires hospitalization. Some of our other dogs may have very light diarrhea, but then it converts to bloody colitis and needs a little intervention. So we do ask that you make that phone call, see if we can determine if it's something that can be treated at home. As a rule, the over-the-counter medications for dogs, for humans, are not safe for dogs and cats. For example, Pepto-Bismol contains salicylates, which are toxic to cats. It tends to cause stomach ulcers in dogs. So Imodium, Pepsid, famotidine. There are some uses for over-the-counter drugs, but we really need to know the pet first. There are some general recommendations. So, got a vomiting dog, withhold food and water, and give us a call. I should mention the bland diet. That is very helpful to recover. We need something easy to digest. So not just, people say, well, I just feed them dry dog food. Now we actually want to go a step blander. The basic bland diet recipe is 2 parts of cooked rice, and 1 part of a protein source. The protein can be lean ground beef, chicken, cottage cheese work very nicely. You want to cook these any of these things and chopped finely, mixed 2 parts of rice to 1 part of the chicken. So for example, if you have 2 cups of rice, only 1 cup of chicken. And that can be mixed up, kept in the fridge, and then scooped out in small meals. A dog that's vomiting, do not allow them to drink a large bowl of water. It's very simple. They drink a large bowl of water because they're thirsty, they have a bad taste in their mouth. The stomach will stretch, trigger the vomiting reflex, and up it comes. So, first thing is no food and water for a period of time, followed by a bland diet under the supervision of one of our good veterinarians here at Manchester West Veterinary Hospital. Thank you.